Thank you very much. Eva, I'm going to follow your advice and limit my remarks to an hour. 5 minutes. I also want to acknowledge the Segal family. I see Tom and Marty, and I'll tell you, when we finally pass this legislation, which I just want to give you a brief report on it because it's empowering, I'm naming the Mental Health Equitable Treatment Act. I'm going to come on the floor and give a long speech. I've said this to Tom many times and dedicate it to Gloria Segal. I remember saying at Temple Israel once that Gloria Segal was the person who stepped forward first and was willing to light a candle for all of us. So my work is in memory of Gloria Segal. We passed this in the Senate last week, and this is not I story at all. It's a different story. It's called the Mental Health Equitable Treatment Act, and to make a long story short, you know what this legislation does if we can now keep this in conference and pass it? It ends all discrimination in all health care coverage across the country. No longer can you have higher co-pays, deductibles, restrictions on days out of hospital, days in hospital. Got to treat this illness like any other illness. And if it happens, the great thing about it is it's not only civil rights legislation ending discrimination, but you know that the care will follow the money. Once the health plans now have the money, we'll begin to have an infrastructure of delivery of care to people. And it's so significant, but the only reason it happened is because in the last 7-8 years, you've had the citizen politics where men and women and sometimes their sons and daughters have stepped forward and told their stories and have just basically said, we're going to speak for ourselves, be our own leaders, we're going to end this discrimination. That's why we had 65 co-sponsors. That's why there are people who oppose this in the Senate. But they couldn't come to the floor to oppose it because we had the votes, because people finally around the country made the difference. We've got 3 weeks, I said to Rabbi Adras, to make the difference, because it's going to go to conference committee and we got to keep it in and there's going to be resistance. But I am so excited to give that report to you, because I really think that because of you and gatherings like this and people speaking up, we really are making a huge difference. Now, the interesting thing is that Eva said, she also mentioned addiction, I think, or substance abuse. That's not in. It should be. I have a bill with Jim Ramstad, who is himself in recovery. But you know what? There's even more stigma there. And we haven't had the same kind of yet grassroots politics, and that's going to happen next. But I want you to know that these gatherings are so important, and we really are, I think, starting to make a huge difference in the country. And my final point is, but we still have a journey to take. I mean, we have to end the discrimination in Medicare. Do you know that if you want to go see a doctor in Medicare, and you want to go see an individual doctor outside the hospital for physical illness, it's a 20% copay. If you want to go see a doctor because you're struggling with depression, the highest rate of suicide is with elderly population. It's a severe problem with young people, but the highest rate is elderly. If you go to see a doctor because you're struggling with depression, it's a 50% copay. That's just blatant discrimination. We need to end it in Medicare. We need to end the discrimination in our courts. We need to end the discrimination in our workplace. We need to end the discrimination in our schools. We need to end the discrimination in our country, and I am convinced together we can. Thank you very much.